Yes, I mean, these are promising signs, and scientists are pinning hopes on this Oxford University vaccine that is currently in development at the moment, and they're saying that particular vaccine is showing the most promising signs at the moment. And yesterday we had the announcement that Prime Minister Scott Morrison signed a letter of intent with AstraZeneca to distribute the vaccine, and AstraZeneca is saying that if these promising signs continue, that they're ready, or they're pledging to sign a deal with manufacturers within weeks, and the federal government is saying that the elderly and also healthcare workers will be the first to get it, and potentially they'll be getting it early next year. Now, there's also been talks about whether the vaccine is going to be mandatory. Well, on Melbourne radio yesterday morning, Prime Minister Scott Morrison said that the vaccine will be as mandatory as possible, with the federal government saying that they're wanting a 95% uptake to get that herd immunity going within the population, but then backtracked on those comments on Sydney radio in the afternoon, saying that the vaccine will not be compulsory. Now, Australia's Deputy Chief Health Officer, Dr. Nick Coatsworth, held a press conference yesterday, and he was saying that restrictions could be placed on people who don't get vaccinated.
There needs to be some sort of incentive stick, perhaps, through the current programs, including No Jab, No Pay, looking at specific things like not being able to go into restaurants, not being able to travel internationally, not being able to catch public transport, or more broadly having what in the olden days would have been a yellow fever vaccination certificate. But there's no current mechanism to enforce that sort of thing at the moment.
Now, Pete, of course, we've heard this before, that there's promising signs of a vaccine, but it looks to be within these companies and within the federal government, the wheels are definitely turning on this, and promising signs that it could be months away.
OK, we'll wait and see.